Hi there, I'm Dr. Bayrak, and if you're watching this, you're scheduled for a deep plane face and neck lift. This video is going to walk you through everything you need to know to feel prepared. What to have on hand, how to get ready, what to expect, and how to take care of yourself afterward. We'll still meet briefly in person before your procedure, but watching this ahead of time will make sure that you're prepared, and you can re-watch it whenever you'd like. So let's start with the big question. What exactly is a deep plane face and neck lift? Unlike older techniques that only tighten the skin, this procedure works at a much deeper level. I go beneath the facial muscle layer, called the SMAS, and reposition the underlying tissues. That's what gives it such a natural, long-lasting result. At the same time, I perform a neck lift to sharpen your jawline, tighten loose skin, and restore a smooth contour under the chin. The incisions are carefully hidden around the ear and into the hairline, so once healed, they blend in beautifully. All of your sutures are absorbable, which means they dissolve on their own. Nothing needs to be removed. In some cases, I may also place small drains behind the ears. That's a decision I make during surgery depending on what I see. If you do need drains, they're temporary and usually come out within just a handful of days. You may or may not also be having other accessory procedures performed at the same time, such as a brow lift, eyelid surgery, CO2 laser, fat grafting, or all of the above. The instructions in this video apply to all of these procedures as well, unless I specify otherwise. Before surgery, it's important to have everything you'll need on hand so recovery feels smooth and stress-free. Start by filling all of your prescriptions ahead of time. This includes your antibiotic, steroids, anti-nausea medication, and pain medicine. I also recommend starting a probiotic to support your gut while you're on antibiotics. From the Amazon list we've provided, make sure you order a facial compression dressing. This gentle support is key for minimizing swelling and helping your tissues heal exactly the way we want them to. Other essentials include ice packs for swelling, a petroleum-based ointment like Vaseline or Aquaphor, Q-tips, and hydrogen peroxide. I also suggest having both topical and oral Arnica montana, as well as oral bromelain, ready to go. We'll cover the timing for those a little later. Everything is laid out for you in your handouts and the Amazon list we've shared, so gathering supplies should be simple and straightforward. If you're taking GLP-1 or GLP-2 medications, such as Ozempic, Wegovy, Mounjaro, or Zepbound, these must be stopped 4 weeks before surgery. These medications can slow down how your stomach empties, which increases your risk during anesthesia. You'll be able to safely restart them 4 weeks after surgery once your recovery is well underway. Let's go over what to do in the 2 weeks leading up to surgery. First and foremost, absolutely no nicotine. That means no smoking, vaping, patches, or gum. Nicotine slows down healing and increases the risk of complications, so this is non-negotiable. Second, stop any supplements or medications that can thin your blood and increase bleeding. Common ones include aspirin, vitamin E, fish oil, green tea, and garlic. You'll find a full list in your diet and medications handout, so make sure to review it carefully. And just a reminder, don't start Arnica or bromelain until after surgery. This is also the perfect time to take care of your body. Get good sleep, stay hydrated, and eat balanced meals. One thing I really want to emphasize is sodium. Salt is one of the biggest drivers of swelling. The less you eat, the better you'll look and feel in the days after surgery. Try to keep your sodium under 1,250 milligrams a day and avoid restaurant meals, processed foods, and salty snacks. Patients who stick to a low sodium plan always notice a difference. The day before surgery, take a little time to set yourself up for success. Double check that you have all of your medications and supplies ready. Get your recovery space comfortable and easy to navigate. Think extra pillows or a wedge, a cozy blanket, chargers within reach, and something to keep you entertained while you rest. One of the most important things you can do is stay hydrated. Drink plenty of water throughout the day, enough that your urine is nearly clear. Going into surgery hydrated makes anesthesia safer, helps you feel better afterward, and supports your healing. You'll receive a call from the surgery center the day before your procedure to confirm your arrival time, so keep your phone nearby and turned on. Please note, your surgery will not be at the Westchester office. It will take place at the Christiana Care Surgery Center in Glen Mills, Pennsylvania, formerly known as the Surgery Center at Britton Lake. Most importantly, because you'll be under general anesthesia, you cannot eat or drink anything after midnight the night before surgery. This includes gum, candy, and mints. Following this rule is essential for your safety. On the day of surgery, keep things simple and calm. Again, because you'll be under general anesthesia, you must not eat or drink anything after midnight the night before. Take a shower either the evening before or the morning of surgery. Wash your face, hair, and body thoroughly, but don't apply any makeup, lotion, or skincare afterward. If you have false eyelashes, they must be removed before surgery. Wear something that buttons or zips in the front, nothing that has to go over your head. I recommend baggy sweatpants and slip-on shoes so you'll be comfortable before and after your procedure. Please leave all jewelry and piercings at home. For your safety, there should be no metal on your body at all. Plan to arrive 1 hour before your scheduled surgery time. For example, if your procedure is at 7 a.m., you need to be at the surgery center by 6 a.m. You'll also need a responsible adult to drive you to and from surgery and stay with you overnight. When you arrive, you'll check in, change into a gown, and meet the nursing and anesthesia teams. I'll review the plan with you, mark your face, and then we'll head back to the operating room. Your companion is welcome to wait in the waiting area during your surgery. If they prefer, they can also go home, go to work, or run errands. We'll keep them updated by phone so they know exactly how things are going and when you'll be ready. When you wake up, you'll be in recovery with a head wrap in place. If drains were used, you'll see small bulbs tucked behind your ears. The very next morning, I'll see you in the Westchester office to remove that head wrap and transition you into a more comfortable compression dressing. Please bring the compression dressing you ordered from the Amazon list to this first appointment. You'll need to wear it essentially full-time, day and night, for the first week. After that, most patients can transition to wearing it at night only, unless I tell you otherwise. I'll also see you again within 7 to 10 days to check your incisions and make sure your healing is on track. The first week is the toughest. Swelling, bruising, and a heavy or tight feeling are expected. Bruising changes color as it heals, from red or purple to green or yellow, and that's completely normal. Things usually peak around days 2, 3, 4, then gradually improve day by day. By 2 weeks, most people feel comfortable going out with makeup and maybe a scarf or high collar. By 4 to 6 weeks, you'll feel socially confident, and while you'll look great early on, the tissues continue to soften and refine over the course of a year. It is completely normal to notice uneven swelling, lumpiness, or firmness under the skin as things heal. These improve over time. It's also very common to feel numbness, tingling, or tightness around the ears and cheeks. These sensations fade gradually over weeks to months. Most patients feel comfortable driving again after about a week, once they're off narcotic pain medication. That said, your neck will still feel tight for several weeks, and you'll need to limit head turning, especially when checking blind spots. For the first 6 to 8 weeks, it helps to go slowly and rely on lane assist or backup cameras if your car has them. As for travel, you should avoid flying domestically for at least 3 weeks if possible, and internationally for 6 weeks. Flying too soon can increase swelling and put you at higher risk for complications. Once cleared, remember to avoid lifting heavy luggage. Every surgery comes with some risks, even though serious complications are rare. With a facelift, the most common things you'll notice early on are swelling, bruising, numbness, or a feeling of firmness under the skin. Healing almost always looks a little uneven from side to side at first, and it's very common to feel like you have a good side and a bad side. Both sides heal just fine, they just get there at slightly different speeds. Less common risks include hematoma, which is a collection of blood that can form under the skin, infection, delayed wound healing, or scars that are more visible than expected. Some patients may also notice areas of hair thinning or changes in the hairline near the incision. Very rarely, there's a risk of temporary or even permanent nerve injury, which could affect movement or sensation in part of the face. Skin loss or tissue necrosis is also extremely rare, but can happen. Other things to be aware of include asymmetry, prolonged swelling, lumpiness, or changes in skin texture as the tissues heal. Most of these issues improve over time, but in some cases, revision surgery may be needed. We'll go over all of this and review your consent form together at your in-person pre-op. Once you're home, there are a few important things to keep in mind as you recover. For the first 2 to 3 weeks, sleep on your back with your head elevated, either in a recliner or with extra pillows. This helps keep swelling down. You can shower 48 hours after surgery and get your hair wet. When you do, use a little Dawn dish soap to gently wash around the hairline and incision areas. It helps cut through the Vaseline or Aquaphor without being harsh. For the first 48 hours, use ice as much as possible. That's when it makes the biggest difference in swelling and comfort. Keep your activity light, no bending, lifting, or strenuous exercise for at least 3 weeks. That said, I do want you walking every day, even just around the house. Gentle movement helps circulation and lowers your risk of blood clots. Cardio should wait until 3 weeks post-op, and weightlifting or resistance training must wait until 6 weeks. Avoid alcohol, direct sun, and high heat, like saunas or hot yoga, for 6 to 8 weeks. Let's talk briefly about how to care for your incisions. You'll want to clean the incision line gently twice a day. I recommend using a Q-tip dipped in hydrogen peroxide to soften and lift away any crusting. It's important not to scrub. Just roll the Q-tip along the suture line to keep things clean. After you clean it, apply a very thin layer of Vaseline or Aquaphor over the area. It doesn't need to be thick or greasy, just enough to keep the stitches moist and prevent scabbing. These are dissolvable stitches, so they'll come out on their own, usually between 1 to 2 weeks. Don't pull at them or try to speed up the process. A mild itchy feeling around the 1 week mark is common and simply a sign of healing. Starting at 2 weeks after surgery, you can begin using a silicone scar gel once or twice a day. Just make sure the incision is fully healed and there's no open skin. This helps optimize how the scar fades over time. Scars usually look pink at first, then gradually fade and blend in over the course of a year. You can safely color or highlight your hair starting at 4 weeks after surgery. Before then, avoid any harsh chemicals near the incision lines. At 2 weeks post-op, you can usually restart your normal skincare routine, but hold off on strong actives like retinols, glycolic acid, or other exfoliating acids until I give you the green light. Professional treatments like facials or dermaplaning should wait until 6 weeks, and microneedling or laser treatment should wait at least 3 months. Injectables like Botox or Dysport are typically fine at 4 weeks, depending on your healing. If you're wearing makeup, avoid the incision area entirely until 2 weeks post-op. These are prescription strength doses, different from what you'd buy over the counter, and safe to take exactly as prescribed every 8 hours, but not at the same time. Here's how it works. You'll take your Tylenol dose, then 4 hours later, your ibuprofen dose. Then 4 hours after that, another Tylenol. By alternating them this way, your pain control is topped up every 4 hours. You'll also have a narcotic pain medication, oxycodone, available, but this is not to be scheduled. It's only to be used as directed if you need it in addition to the Tylenol and ibuprofen. Narcotics can cause nausea, which is why you will also be prescribed an anti-nausea medicine. This can be used if you need it, but don't take it if you aren't feeling queasy. You'll start your antibiotic and your steroid pack the day after surgery and continue them until the full course for both is finished. Pair these with a daily probiotic or yogurt to protect your gut. You can start arnica and bromelain after surgery, following the directions on the packaging. Remember, swelling, bruising, and even some oozing from the incisions are expected. Contact the office if you have bleeding that won't stop, rapidly expanding swelling, fever, pus, severe pain not relieved by medication, or any sudden change in breathing or vision. And that's it. You made it through. It may feel like a lot of information, but watching this in advance will really help us make the most of your in-person pre-op appointment. You can revisit this video anytime, and of course, if anything comes up in the meantime, don't hesitate to reach out. If you're ever unsure, reach out via text to 484-424-9640 or email assistant@bayrakmd.com. At your in-person pre-op with me, we'll take standardized photographs, so please do not wear makeup. We'll also collect the remainder of your balance and answer any questions you may have. Healing is a journey, and patience pays off. Every week you'll see improvement, and your results will continue to refine over the course of the year. I'm excited to take great care of you, and I'll see you soon.